You know, the AFP has just, the French news agency, has described the claims as false, that Ghana is leading in the number of testing that has been done so far. We have the figures as put out by the AFP. So I'll start with, I'm sure Dr. Bernard Okoe Boye, will you go with it?
Yes,
which one of you gave the president the wrong information? You know, that's Edward Estifo's concern.
Respectfully, I gave your producer a slide. If you can put it on the screen, I'll be so grateful.
Okay.
It's a slide that tells us the testing regimes across Africa. Countries that are doing very well, blazing the trail. Absolutely. This is one of my favorite slides. The deeper the color, the more testing per 1,000 people. Now, if you look at this particular slide, South Africa, Ghana, and I think one or two of the islands, they are the shining examples on the continent. Out of 54 countries, they fall in the first three: Ghana, South Africa, Djibouti, and I think Mauritius.
Now, in that order?
Yes.
So Ghana first, South Africa?
No,
is that the order you're giving?
I think my focus on this slide is that the three countries that stand out clearly in terms of regimes is Ghana, Ghana, South Africa, and Mauritius. Now, this is my take. 54 countries on a continent. We as a country are over there leading and shining example. Why should we let our strength be on the fact that it should have been South Africa first before Ghana or Mauritius before South Africa? Bottom line, why is Zimbabwe? Why is Nigeria? Why is the Ivory Coast? Where is Senegal? Where is Botswana? All these countries are lagging, and we, Ghana, together with South Africa, are showing the way. This is what should give us comfort, that the president did not set out to deceive, but to send a signal. And please, the testing regime you have is an indication of how serious you are taking COVID-19. Because Nigeria's GDP, they can do 10 times what we are doing. But we happen to be doing what we are doing because the value we place on the battle, forgive me, they are doing less than 1,000 tests a day. We've jumped from about 1,005 to at least 5,000 a day. This is the graph that should make us proud as Ghanaians, that on the continent we are standing with 2 or 3, showing the way, and the whole world appreciates that. This issue of, but South Africa came before you, or you are just behind Mauritius.
Because we were told clearly that we are leading when it comes to testing in Africa.
Absolutely.
We may be part of those who are doing the testing.
The graph is so loud.
Of course. But it does not mean that we are number one, are we?
Absolutely. But my point is that there are 54 countries on the continent.
Of course.
You are in a country, you are a citizen of a country that is part of the first 3. Now, for me, our argument should not be whether we are one of the 3, or we are on the first of the 3, or the second of the 3, but 54 countries. We are part of those showing the way.
But we are not number one.
No, I'm coming. You see,
are we number one?
No, I'm coming. I have had a chat with Dr. Abuaji. We were having a chat before I came here. And one thing he said, which was very significant, is that even testing per 1,000 usually is time specific. Because as we speak, you can have a situation where we can be number one. South Africa, between 2-3 days, can increase their capacity. And in 3 days, the records will show that SA is ahead of you.
Okay.
If we have, remember, the more positive tests you get, the more people you trace. We get a lot of samples that arrive at our lab. Our test regime can go ahead of SA.
Okay.
So for me, once the thing is dynamic, and I've said it here, everything will keep on changing. You must not be caught in the trap of whether really is 1 or 2.
Okay. But so from the list we have, though, from the AFP, tells us that Mauritius is up there, Djibouti, South Africa, then Ghana comes. That's from the AFP fact-checking claim.
Out of how many countries?
I'm yet to,
54 countries on the continent.
Exactly. You have given us that deep
and forgive me, there's one thing too, in statistics, the numbers don't tell you all. You have to go behind. For your viewers, Mauritius has a population of about 1.1 million or so.
1.270 million.
And Djibouti is 985,000 people. Now this is what it means. Yeah, this is what it means. If you divide our testing, there are 170,000 tests or so by our population. For every 1 million, we are doing about, let's say, 6,000 tests. Now what it means is that when Djibouti does only 7,000 tests, they would come ahead of Ghana is because they are less than 1 million. But you must do that 7,000 times 30.
Okay.
So really, to be fair, the smaller the country, the greater the chance that they will jump ahead. And that is where, if you appreciate the dynamics, quickly realize that we have to put in greater effort to show up at where we are than they would do.
Okay.